I would like to take a moment to introduce you to some of our practice philosophy at the Lindsay House. We pride ourselves in having a process. I call it our unique process because it is unique to our practice. It is really driven by educating the patient and providing the best experience that we can possibly provide. So when I look at our process, you often will call the practice and you will speak to my patient care coordinator, who will give you much information over the phone and then also provide you with something that you can read afterwards by mailing it to you. So every step we have is set to sort of meet your expectations of where you are in that step of the process. Our next step is for you to meet our patient consultant. She's going to provide a map, a template that potentially will meet your needs. She will help you get clarity on what you're asking for. Some people come in and say, I want to look better, and that's not very specific. And so we help you get to what it is that you don't like. Once you've met with her, it's a normal process for us in our steps that you then meet with me. And I take that, what I like to describe it as, to a prescriptive level. And I call it the physician prescription, because now we've kind of honed in on what you want, and I really fine-tune the details about what we can do for you. The next step of our process is the preoperative evaluation, and this is done by our expert nurses and nurse practitioners, and they make sure by calling your physician and talking to your specialist that we're going to do this in the safest way possible. And we try to make this as easy as possible for you. Rather than send you all over town for prescriptions, for electrocardiograms, whatever your needs are, we do this all on site, and it becomes a one-stop visit. Even after surgery, you're not running around for prescriptions or supplies that you need to take care of your surgery. We give you what we call a little comfort tote that has everything you need to take you through the surgical experience, which is the next step of our process. And there, I pride myself in having a staff in our operating rooms that are accredited, licensed by the state of New York. We're a freestanding ambulatory surgery center. And I pride myself in the fact that I have people who've worked for me for over 20 years, a secure anesthesia team, where we're going to do this in the safest and most confidential way possible. Imagine coming to a place where it's just for cosmetic surgery. You are apt to run into no one, or maybe one other person, as opposed to going to a hospital, where you're going to run into all sorts of people, and it's really not confidential. So I think that, that step of the process is, for me, probably the most important, because that's where I'm going to affect the result. But I think that without this team that I have around me, we couldn't do it. The next step of our process is the post-operative care experience, and that's very well prescribed. You will have all your appointments prior to surgery, so you know exactly what's happening on each day in the post-operative care experience. There's steps along the way where it's very clear about what you can do, can't do, when you can exercise, when you can't. And I think that is as long as you methodize this kind of thing, there's less chance for error, there's always a greater chance for a better outcome. And it just doesn't end with the surgery. So you're happy, you get discharged at 6 months or a year, depending on what you had, but there has to be some maintenance. And so we have Q, the medical spa, where we provide ongoing care for what you did. It's like taking care of your investment. And in the medical spa, through the combination of peels and SkinCeuticals, like prescriptives like Retin-A, Definage, we will continue to enhance your result and to preserve your result. And so, I really feel that having a methodized system and an approach to this really ensures the best outcome that you can possibly have. And I think that when we do it this way, we almost always exceed patient expectations. And so we look forward to having you engage in our process and become part of the Lindsay House family, and I look forward to meeting you.